Good morning to all. I am Ms. Priyanka Goswami and in today's class we'll discuss about the parenteral dosage form. So these are the content which we'll cover in today's class. Those are introduction, advantages and disadvantages, general requirement for parenteral preparation and followed by route of administration of parenteral product. So, parenteral are one of the important dosage forms which are used in the pharmaceutical industries. This parenteral is divided mainly into two parts. That is, para means outside, however, enteron means intestine. So, the formulation which are given outside the intestine is known as parenteral. Means any dosage form given other than the oral route, that is called as parenteral. The most important factor for a parenteral is it should be first sterile and second it should be pyrogen free. Pyrogen means metabolic product of microorganism. So as because it directly enter to our blood, if it is not sterile or pyrogen free, then tissue necrosis or blood problem may happen. Hence we have to be utmost careful when we prepare this kind of formulation. Next is advantages of parenteral formulation. It is useful for patients who cannot take the drug orally, like the unconscious patient, children who are unable to take the drug orally. It is very useful. Next is rapid onset of action. The site of action is very fast. It is also useful for emergency situation. As I have said, it is beneficial for the unconscious patient. Then it avoids first metabolism, can inject drug directly into the tissue. It is a targeted drug delivery system, and it is also useful for delivering fluid, electrolyte or nutrient. Next is it have better bioavailability when it is compared to other doses form. So these are the few advantages of parenteral dosage form. Now let's see disadvantages. So whenever we'll inject in parenteral dosage form, there may be a pain. So pain on injection. Next is difficult to reverse and administer drug effect. It may cause sensitivity or allergic reaction at the site of action. Requires strict control of sterility and non-pyrogenicity than other formulation. It required trained person. It also requires specialized equipment, device, and techniques to prepare and administer drug. It is more expensive and costly to produce. So next is what are the general requirement we should see when we are doing parenteral preparation. So here are few criteria or the necessities we should do when we are preparing pharmaceutical parenteral preparation. First one is stability, second sterility, third free from pyrogen and toxin, fourth free from foreign particles, and fifth is isotonic. So let's move to the stability. Stability, whatever the product or formulation is prepared should be stable under the predetermined manufacturing, packaging, storage, and usage condition. So the chemical and physical stability should be maintained throughout its shelf life. So stability can be affected by any stage of compounding, mixing, filtering, filling, sealing, storage, shipping, and handling. So a product should be completely stable enough during these stages. Next is sterility. So it means it should be free from microorganism. This can be achieved by following valid sterile procedure for all components, by following valid procedure for aseptic filtration, design and maintenance maintenance of clean room, by following valid test method for sterility of the product, and maintenance of closure and container integrity. Next point is free from pyrogen and toxin. As I said, pyrogen free means metabolic product of microorganism, and they cause rise in body temperature. It may cause fever. These are the few symptoms which your injection is contaminated by pyrogen. It's so this symptoms when your injection is contaminated with pyrogen. So the formulation should be free from pyrogen. So for this, LAL test is done for quantitative detection of bacterial endotoxin in all the parenteral products. Next test is free from foreign particle. That means all the parental products should be completely clear, transparent solution. The solvent which are used in the manufacturing of parental should be free from any visible particulate, and it must meet the compiled specification for number of subvisible particles, which should not be more than 10 to 25 micrometer. It can be achieved by adopting the valid cleaning method of all equipment and packaging material. So next is isotonic. A parenteral must be isotonic with the blood plasma to avoid any kind of irritation at the site of injection. So so far we have covered introduction, advantages, disadvantages, and general requirement for parenteral preparation. So next we'll see route of administration. So parenteral products are administered by a several routes based on their different criteria, including the onset of action, the viability, and the delayed release pattern. So most commonly used route of administration are subcutaneous injection, uh, then intramuscular injection, and intravenous injection. Subcutaneous route that is given under the skin, it is given at 45-degree angle, and intramuscular route given into the muscle, it is administered at a 90-degree angle, and intravenous route are given through the vein. So these are the common route of administration. So there are other route of administration including injection to the brain, in spinal column, in the eye, arteries. So this type of product, however, requires special care and expertise in the formulation, as this area of body are extremely sensitive and are easily damaged if a product is not properly injected. So that's all about in today's class. Thank you.